In this video, we'll discuss the venous approach to treatment of AVM. The axial T2 MRI and sagittal T2 MRI shows a ruptured AVM in the right precuneus. The axial SW image shows that there is hemorrhage around the nidus. The ICA injection shows a patchy nidus in the precuneus. The oblique view shows that there are multiple small feeders supplying the nidus. None of these feeders were deemed big enough to be catheterized. Therefore, we plan for a venous approach. This is the late phase, which shows that there are two draining veins which join together to form a single vein, which then joins the vein of Galen and the straight sinus. Notice the acute angle between the veins draining the AVM and the vein of Galen. This may pose a problem while trying to catheterize the veins. The AP projection shows a patchy nidus which is fed by multiple small feeders, and the late phase shows these two veins draining the AVM, which in turn joins to form a single vein. The plan would be to place a Seribase 088 guiding catheter in the proximal part of the straight sinus. Following that, a headway duo 167 cm 1.3 French microcatheter was placed in the superior vein as close to the nidus as possible. Thereafter, another headway duo microcatheter was placed in the inferior vein as close to the nidus as possible. Then, a flow arrest was achieved by placing two balloons. The first balloon was placed in the right P2 PCA and the other balloon was placed in the M1 MCA and inflated. Prior to injection of onyx, the blood pressure is dropped to nearly 60 or 70 systolic to reduce perfusion pressures. The plan would to be fill the veins with onyx, then percolate the nidus with onyx, and thereafter the arterial system as well as with the onyx. The lateral view shows the Seribase guiding catheter in the proximal part of the straight sinus. The access is usually at the jugular vein in order to cut the catheters at the neck. We do not use a detachable catheter as it can cause shear injury to the veins. You also see an access in the arterial system to place the balloons. Both microcatheters are being placed in the draining veins. The AP projection shows both the microcatheters in place and both balloons in place and inflated. The lateral projection also shows the same. Prior to injection, the blood pressure is dropped and both balloons are inflated to provide very low perfusion pressures in the arterial system. You notice onyx being injected, the veins being filled, and as well as the nidus is being filled now. Progressively, the nidus is filled, and at the end, we will also achieve percolation into the arterial feeders. This is the post-procedure injection, which shows complete obliteration of the nidus. We keep the patient intubated for the next 24 hours. Repeat a CT scan at 6 hours and 24 hours to ensure that there is no hemorrhage. The blood pressure is also kept at the lower end and patient is extubated low. The pressures are monitored for the next 4 to 5 days and kept at the lower side. Thank you.